Hello friends, my name is Dr. Clayton Bell. I'm coming to you Facebook Live right here from University of Tennessee Medical Center in Knoxville, Tennessee. I'm really excited today because this is National Nutrition Month, and nutrition and food is my medicine of choice. It's actually the go-to for the way that I help to treat all patients and helping facilitate them in the healing process to allow themselves the utmost opportunity to have the very best response to whatever medical condition they might be experiencing at that given point in time. You know, it's really interesting because as a doctor, you might just automatically assume that we have a lot of training and education in nutrition, but the truth of the matter is we don't. Usually in medical school, we actually only get a couple lectures throughout the entire thing, and that tends to be on things like vitamin deficiencies. So, doing a lot of independent research and really having a passion for this has uniquely positioned myself and a lot of other similarly minded physicians to be able to help bring you healthy healing tips in regards of all nutrition. Now, my favorite thing about nutrition is it treats every medical condition. So often when you come to the doctor, you might present with something like your blood pressure's high, or your cholesterol's high, or maybe you had diabetes, or perhaps you're looking to lose some weight, and God forbid you even had a heart attack or got diagnosed with cancer. Now we can address every single one of those topics, but as you well know, it can be a medication for this condition or a procedure for that condition, and it's really common by the time you look up, you might be on 5 or 6 or 10 different medications. I've seen some people that are on 20 medications for that matter. The nice thing about nutrition is if you modify your diet, if you clean it up just a little bit, you are going to help every single one of those conditions, regardless of what they are. So people always ask, well, what's the right diet? And there's so much out there, right? You could be vegan or keto or paleo or DASH diet or Atkins or South Beach or Weight Watchers. And what I have found in my experience is it's best if you don't do any diet at all. What you're really going for is lifestyle, okay? And it's actually fairly simple. No matter what diet plan you might adhere to, they all tend to agree on the same fundamentals. And those are going to be whole foods. There's no diet plan out there telling you to eat more Twinkies or more processed white flour foods, okay? So that's the number one thing, is just try to identify the lowest hanging fruit in your nutritional repertoire. So if you drink 3 liters of Mountain Dew a day, try to drop down to 1 liter a day. If you eat Pop-Tarts for breakfast or give them to your kids for breakfast, we grew up eating those, what you might want to do is switch over to a healthier option like oatmeal, right? Add something fun to it, like some peanut butter or some nuts or some fresh fruit, even zest it up with a little bit of honey to add a little sweetness to it. But that'll actually be a lot more nutritionally dense. It'll keep you full much longer versus say the empty calories of something that's just laced with say sugar, like a Pop-Tarts. And you also will get that crash. So you see that a lot, and especially I think about when I was a kid, and you think about it with kids now, and forgive me for not knowing the exact statistics, but I think it's close to 10% of young boys have actually been diagnosed with ADHD and are on pharmaceutical treatment for that. And when you actually start to meet some of these kids and talk with their parents, what you find a lot of times is they're basically eating a high sugar breakfast, and then what happens when they get in the classroom, they're crashing. They're coming off that sugar high, the insulin is kicking in to keep the blood sugar into their cells to keep it out of their bloodstream, which is an appropriate response, and then they're crashing, right? And so if you get more fat and protein in there, whether it's eggs or having avocado with your eggs for breakfast, or the peanut butter, the nuts, the avocado on toast or peanut butter on toast, anything simple like that. And you could do a healthier toast too. It could be a multi-grain toast, some sprouted grains, like Ezekiel or Dave's bread. Those are better, healthier options for you as well. But regardless, you kind of see the gist. We're trying to go away from all these prepackaged, processed, call them faux foods or near food-like products. So where are you going to see these? You're essentially going to find them in the aisles of the grocery store. So if you were going to walk in the grocery store, what you essentially want to do is walk in and you're going to buy everything on the perimeter of the grocery store. That's where all the real food is. Okay, that's where your vegetables are going to be, your fresh fruits are going to be, maybe your fish, maybe even some cleaner organic meats, what have you, are going to all be on the outside of the store. Now, if you need to go in for olive oil or like brown rice, obviously, you can get that from the aisles. But the vast majority of everything you see there is bioengineered to be physiologically addictive, okay? And it's bioengineered to have just the right amount of sugar, fat, and salt to keep you hooked to it. And the food companies don't even try to hide this. You might remember the Pringles commercial of once you pop, you can't stop, right? That's the way it goes. Certain foods are not only addictive from the aspect of sugar, and so that kind of becomes one of the main problems with nutrition in our country. People that eat the standard American diet eat heaps and heaps and heaps and heaps of added sugar in their diet. And the food manufacturers are pretty savvy. So they put it under a lot of different names, but pretty much if you put it in your mouth and it melts in your mouth and its color is white or like a light tan, you can pretty much be guaranteed it's just sugar. It's been bioengineered in different packages that look a little differently. But that's going to be all the yummy, ooey gooey things that you would ever get. So think about like cookies, crackers, scones, cakes, the vast majority of cereals, white pastas, white rice, the list goes, crackers, the list goes on and on and on and on and on. What we really want to do is eat the rainbow, something with a lot of color to it, okay? If you can, you want to try to get something from every color of the rainbow almost every day. A really easy way to think about this would be go to the grocery store with your kids, right? And let them pick out things from all different spectrums of the color wheel. So maybe green, you'll get your broccoli or your Brussels sprouts or your lettuce or your kale. Purple, you get real wild and get something like eggplant. Yellow could be squash. But you just want to mix it up. You want to try to stay away from all the white foods, essentially. Another good rule of thumb is when you go grocery shopping, let's say you had a 5-year-old kid. Imagine you did. Maybe you did in the past, or maybe you will in the future, or maybe you remember being 5. If you give the food to your son or daughter, if they can pronounce every ingredient in there, you can eat it. If they can't pronounce what's in there, you shouldn't be eating it. Also, if those foods have more than, say, a handful of ingredients in there, you shouldn't be eating it. And you can read labels and you can look for healthy foods like gluten-free this, but those are essentially just really expensive junk foods, okay? Real foods don't have labels. Apples don't have labels. They don't have nutritional facts on the side of them, okay? So essentially, in a nutshell, the easiest way to think about it is just eat foods that are natural. Eat foods that God made, okay? It grows off of a tree or out of the earth, eat it in its natural form. Occasionally, maybe you eat something that swims or walks around. If you are eating animal products, whether it's milk or cheese or chicken or eggs or fish, definitely make sure it's organic, grass-fed, free-range. It's really worth it to pay the extra money and get the good stuff for multiple different reasons. We don't have time to go into them all right now, but one of the most simple ones is just actually the feedstuffs that those animals eat will have a radical different impact on their actual muscle tissue and the flesh that you'll be consuming. For instance, if you do a grass-fed beef versus stockyard beef, they're going to have a radically different pro-inflammatory omega-6 fatty acid ratio, which is going to predispose you to things like colon cancer, heart attacks, strokes, versus more omega-3 fatty acids, which you might have heard about. They are really famous in foods like salmon, right? Also things like flaxseed or chia seeds, walnuts have those as well too. And so that's the time you really want to pay the money to get the extra good stuff. Other times, yeah, you can eat organic if you have that opportunity, that's great. But don't skip vegetables, don't skip fruits because they're not. The benefit you're going to get from them are going to far outweigh the extra benefit of them not having those herbicides or pesticides. And then if you are going to make those choices, what you really want to do is pick things that you would essentially be eating the skin, so like apples, blueberries, kale. Those are going to be more important to spend a little extra money on to get the organic stuff. If it's an avocado, don't spend $3 on that organic avocado. If you're on a price budget, spend 85 cents on it because it's going to have a protective shell around, so it's not going to contain near as many of the pesticides or herbicides. if you choose something different for environmental reasons or animal welfare reasons, that makes total sense as well. But just from a purely nutritional standpoint, that's a good rule of thumb. So I get a lot of different questions about nutrition for multiple different conditions. Some of them are metabolic conditions like diabetes or people trying to lose weight. Sometimes it's people that come in with things like a history of a heart attack or stroke. How do they prevent that? A lot of times it's cancer. And I'm fortunate enough to get to work with a lot of amazing physicians and a team here at the University of Tennessee Medical Center Cancer Institute. And one of the most important things that you can possibly do to prevent the risk of cancer is eating a good, healthy, clean diet. And there's different reports out there that talk about the prevalence of cancer that's due to diet, and from a conservative standpoint, it's at least 30%. Now, certain cancers, it's a lot higher. Things like colorectal cancer or prostate cancer, we think, are about 70% linked to diet. And so you might be asking, whoa, what is that coming from? Well, not everybody, because some people eat really clean diets and they still get these conditions, and it's really sad when that happens. But the prototypical colorectal cancer is going to come when people don't get very much fiber in their diet. So things like whole grains are going to be the most protective. Okay, people are dehydrated, so they don't get enough water in, they don't get enough vegetables in as well, and they can eat lots of processed and red meats. That's not everybody at all, but that's kind of your prototype, right? Textbook, at risk, beware, diet, don't eat that. Another one for prostate cancer is actually dairy. So men that consume lots of dairy products, and I see in my practice a lot, I see a lot of prostate cancer, almost all of them have a high history of milk or cheese intake. And so those are foods you want to avoid if you're at risk or you have a history of prostate cancer. It's really interesting because there's no food that's really good or bad. So dairy products have actually been shown to be protective against colorectal cancer. So once again, food are just like every other medicine. What might be appropriate for one person is not necessarily appropriate for another person. So that's why there's not one diet that fits all. I practice Ayurvedic medicine too, which goes back to India about 5,000 years, but what we found is there's different mind-body archetypes. And of those different archetypes, different people respond better to different types of food. So this person over here might do better with a whole food plant-based diet. This person might do better having a little animal protein in there. It's really interesting. So we could go on and on and on and on for hours and hours and hours about this, but I just want to wrap it up with you guys, and I really appreciate your time and attention. And please feel free. We have some excellent resources here at University of Tennessee Medical Center. Folks like myself that would love to do a nutritional consultation with you. We have dietitians here. I have partners. Dr. Rocio Hewitt has a great primary care integrative practice, and our new partner, Chris Harris, who's an integrative medicine physician as well. And we're happy to discuss those things with you. At the Cancer Institute, we have a dietitian, Amy Cran, as well, who's actually able to see all their cancer patients here for free that we can get her to see. But as we learn as a medical industry how important food is, you're going to start seeing more and more and more and more of the science that comes out. And if you're watching this, I would personally challenge you right now. Don't farm out your health care to me or any other doctor or even this wonderful medical system. You need to take charge of your health. It's your life. Okay? And the very best way to start that is by looking at what you're putting on your plate and on your family's plate 3 times a day. So thank you so much for coming and hanging out with us today. I really appreciate it. I want to say thanks to the University of Tennessee Medical Center for giving us the opportunity. Please come bless us with your presence and let us help you in the healing process. And share this with your family and friends and spread the word. All right, thank you.